onto this. Dr. Tim de Maayer, a paediatrician at Rahima Moosa Mother and Child Hospital, has returned to work after a brief suspension for publicly criticizing Gauteng's healthcare services. In a statement, the department said the matter has been resolved amicably. On Thursday, Health MEC Dr Nomathemba Mokgethi revealed that there has been a dramatic rise in cases of patient negligence in Gauteng's public hospitals, which have jumped from 4,701 in 2020 to 6,910 recorded, a 47% increase over the past year. The MEC was responding to questions from the DA in the provincial legislature. The DA's Jack Bloom joins us now to elaborate further. Thank you so much for joining us, Mr. Bloom. Perhaps your response to the reinstatement of Dr. Tim de Maayer.
Well, it's obviously very welcome. It should never happen in the first place. I mean, this is a dedicated doctor. He's actually a hero, and instead of being praised for exposing the situation and doing something to fix it, he was suspended. So I think the person who should have been suspended, and we should still look at this, is that the CEO of Rahima Moosa Hospital. How could she take this terrible step? It's now been reversed, but I think, she's partly to blame for the terrible situation at that hospital, and we need to have her investigated as well. But yes, very welcome news that he's been reinstated.
Well, let's talk about the public health services in Gauteng, a 47% increase in cases of patient negligence. Are you at all surprised at what is seemingly the worsening state of public health in the province?
Well, it's very disappointing because, I've been highlighting the medical negligence cases over the years, and the latest statistic shows quite a big jump. I mean, and it's probably an underestimate, probably the tip of the iceberg. A lot of medical negligence cases aren't reported, and we all know about the state of our hospitals from patients and relatives who have to deal with them. It's very distressing. It shows that there isn't any progress. I've been in the Gauteng legislature since 1994 and tracking the decline of the Gauteng Health Department. When Premier Dave Makura became Premier 8 years ago, he promised there would be, quote, an emergency turnaround of the Gauteng Health Department. Now, 8 years later, all we have to show for is scandal after scandal. I think something drastic needs to be done. The rot is very deep indeed there. And I think we need to see results. Enough with excuses, and enough with, such a terrible incident has happened with suspending Dr. Tim de Maayer for doing his job.
Talking about something drastic needing to be done, I mean, the Health MEC in her written reply to your question mentioned that cases of patient negligence were happening at central, through to tertiary, through to district and regional hospitals across the province. I mean, that is encompassing all tiers of public health in the province. Are we talking about a complete overhaul of the Gauteng Health Department at this point? And what would something like that, what would an exercise like that even look like?
Well, for more than a year, we haven't had a permanent head of department and a permanent CFO. They both left, off the scandal with the PPE supplies. Finally, last month, we got a new head of department and a new chief financial officer, and they've got a big task ahead of them. I feel very sorry for them, actually, because it seems to me the problem is that it's at all the health facilities that fall under the Gauteng Health Department. There's more than 300 clinics and there's 37 hospitals. I think there's a leadership problem at many of the hospitals and many of the clinics. And as we've seen at Rahima Moosa Hospital, I think the CEO is to blame in many aspects for the failure. How was she appointed there in the first place? So I think there's an overhaul that needs to go from top to bottom. And the bad news doesn't stop. At the Gauteng Health Committee 10 days ago, we heard that the unpaid suppliers are as bad as ever. 80% of the suppliers don't get paid within 30 days, which is a legal requirement. And the accruals, the unpaid debts have now ballooned to over 6 billion rand. I mean, that's unbelievable. And all this money, the unpaid debts of previous years, which date back to 2017, have to come out of the present health budget. So I think that we need to look at decent management, decent financial controls, and listen to the Auditor General. Every year, the Auditor General issues a scathing report to the Gauteng Health Department. He talks about irregular and unauthorized spending and what should be done to fix it, and it never is fixed. So once and for all, listen to the Auditor General, put the right people in the right jobs, stop all this corruption and wastage of money, and fix up the department.
I mean, the issue of funding is something that was raised by the MEC herself, that they don't seem to have enough funds to actually service the people of Gauteng, which is why we're seeing, you know, a lot of the sort of disturbing and harrowing stories and tales from these public health facilities, the tales of patients not being given food, having to feed and fend for themselves, or sometimes at the assistance of healthcare professionals. How true or how legitimate is the concern around funding? We know that, you know, with the COVID-19 pandemic, we did see some budget cuts to a number of departments. Could this be a compounding product or a compounding effect of those earlier decisions?
Well, we could always do with more funding, and we really need to fill all these vacant positions and make sure that there's proper functioning equipment in all our hospitals. But then you see the waste that goes on. You know, we spent more than 500 million rand on a ghost hospital in the far west rand. This is the Anglo-Shanty Hospital. That's how much money they spent on it, so supposedly for COVID patients. It never saw more than 100 patients, and none of them were serious. And now we've got this white elephant ghost hospital in the far west rand that they've spent more than R500 million on. And I could give you other examples where there's just been massive waste of money, particularly because the department has to deal with the Gauteng Infrastructure Development Department, which is totally incapable and full of corruption. So the one of the big tragedies is the ongoing failure to reopen the Mokgethi Johannesburg Hospital. Now, you know, the provincial government has basically said, well, we can't do it because so we've tried, and they've given it to the National Health Department. Now, people are really suffering, and that's not a matter of lack of money. That's a matter of poor management and corruption and absolute incompetence. So, you know, fix that up first. Put a decent CEO in charge of Rahima Moosa Hospital and other hospitals, and then do the best with what you have. But what I see is just a lot of wastage and incompetence and terrible treatment of doctors like Dr. Tim de Maayer. I mean, in fact, that just epitomizes the whole problem in the Gauteng Health Department. They should have learned from the Life of Sedimeni tragedy, where people were afraid to speak out. They were censored. They thought they'd lose their jobs. And the lesson there should have been that health workers need to speak their conscience, and they should be listened to. And here, Dr. Tim de Maayer spoke his conscience in favor of saving the lives of children, and he was punished for it. So where do we start when the whole culture at the department just seems to be so rotten?
I mean, if with all of these widespread concerns that you've mentioned, are we talking about an intervention from the provincial government alone, or is it time for something more of a national level of government intervention to address some of the concerns that we've talked about here this morning?
Well, I'm not sure that national intervention will actually solve something that needs to be solved at the provincial level. And all I hear from Premier David Makura is that there's a task team has been set up. It was one that was supposed to be set up at the beginning of last year. Well, if they're making recommendations, implement these recommendations. I don't think it's rocket science to know what makes a decent department function. You know, part of the problem is cadre appointment. We're not deployment. We're not putting the right people in the right jobs. They're politically appointed. So why don't we get back to appointing, you know, competent people, honest people who can do the job. So until we do that, not just at the head office of the Gauteng Health Department, but at every single one of the 37 hospitals, every single one of the more than 300 clinics, then I think we're just going to get more of the same. Tragedy upon tragedy and patients suffering.
Well, Jack Bloom, we are going to have to leave it there. That's Jack Bloom, a member of the Gauteng Provincial Legislature, giving us an overview there of the state of public health facilities in the province.